You know, when we talk about healthcare costs in 2025, most people focus on the numbers, the premiums, the deductibles, the charts that rise like a stubborn tide, no matter how many times leaders try to hold them back. But if we're honest with ourselves, underneath those numbers is a quieter truth. It's the reality that every dollar an employer spends or doesn't spend represents a decision about someone's life, someone's family, someone's sense of security at the end of a long workday. And in that gap between financial pressure and human need, you find one of the great moral paradoxes of our time. How do you protect the bottom line without eroding the dignity of the very people who make that line possible? How do you measure responsibility not just in balance sheets, but in the well being of a workforce that depends on you? Most people overlook this tension. They see employers tightening policies or shifting costs and assume it's just business. But behind those choices is a story about leadership, about democracy in the workplace, about who we choose to be when doing the right thing is also the hardest thing. And so the question becomes, what does it really mean to care for people when caring comes with a cost? When you look back at the early 21st century, you see an era under immense strain. Prescription drug prices rising faster than wages, chronic diseases taking root in communities stretched thin, workforces more diverse, more complex, with needs that don't fit neatly into old models. Employers felt this pressure like a weight on their shoulders, not just financial pressure, but moral pressure. They were confronted with a healthcare system that demanded more each year, and workers who trusted them to provide coverage that wasn't just symbolic, but meaningful. So they tried to innovate. High deductible plans became common, sometimes too common, paired with health savings accounts meant to empower people, even as they shifted more risk onto their backs. Some companies moved to self funded insurance, betting that with better data, better strategy, they could care for employees while cutting unnecessary costs. Others embraced telehealth, remote consultations, tools that made healthcare more accessible, and in some cases, a little less expensive. But none of this was simple. Every innovation came with an ethical dilemma. Every cost saving strategy carried the risk of deepening inequality if it wasn't done with care. And in boardrooms across the country, you could feel the tension between scarcity and generosity, between innovation that helps and innovation that simply shifts burdens. It was a moment that revealed something profound. Healthcare isn't just an economic issue, it's a civic one. It tests whether our institutions, whether our leaders can uphold fairness and empathy when the stakes are high and the choices are messy. I've seen versions of that struggle before. When I was organizing in Chicago, I met parents who worked two jobs yet worried every night about what would happen if their child got sick. Later, in the White House, I learned quickly that healthcare, far from being a spreadsheet problem, was a story told in millions of households, in urgent care waiting rooms, in the quiet conversations between spouses at the kitchen table deciding which bill could wait. And I carried that with me every time we debated policy. Because when you're responsible for people's well being, when your decisions ripple outward into the lives of families you may never meet, you start to understand leadership in a different way. You stop seeing it as a game of winners and losers. You see it as stewardship, a duty to look beyond the next quarter or the next election and think about the kind of country, the kind of workplaces we're building. I remember moments in the Oval Office, late at night, when you're staring at numbers that won't balance and ideals that won't bend. You wrestle with doubt. You ask yourself if you're doing enough, if you're seeing clearly the people at the heart of the policy, and sometimes you find clarity in the most unassuming places. A conversation with a nurse, a letter from a small business owner who wants to do right by her team, a quiet realization that progress isn't about perfection, but perseverance, and maybe a little humility, because no leader gets it right all the time, not even presidents. But here's the deeper truth. Healthcare costs don't just strain budgets, they test our values. They force us to ask whether we believe that every person, no matter their job title or paycheck, deserves dignity when they're sick, support when they're vulnerable, and access to care that doesn't push them further into hardship. They reveal the tension between unity and division. Whether employers see their workforce as partners in a shared project or as line items to be minimized, they highlight the paradox of power and responsibility. When you have the ability to shape someone's well-being, even indirectly, you also inherit the moral duty to do it with fairness and foresight. And beneath all of this lies a broader story about democracy. Because democracy isn't just what happens in voting booths or congressional halls, it's also expressed in workplaces, in economic choices, in whether we treat healthcare as a privilege for the few or a shared investment in human potential. When employers choose transparency, when they invite employees into the conversation instead of shutting them out, when they innovate with empathy and not just efficiency, they strengthen the bonds of trust that hold societies together. But when decisions are made in ways that deepen anxiety or widen inequality, those bonds weaken. The workplace becomes another site of polarization in a world already stretched thin. Still, I believe in the long arc of progress, even in this difficult domain. Humanity has traveled a long road, from an era where illness meant isolation to a time when we recognize health as a cornerstone of justice. And though the path ahead is steep, rising costs, demographic shifts, technologies that could heal or harm depending on how we use them, I've learned that progress is possible when leadership is grounded in courage and a commitment to the common good. Hope isn't a cliche, it's a choice, a strategic one. It's what allows innovation to serve people rather than replace their humanity, and what reminds us that the burdens we carry are lighter when we carry them together. So, as employers across the country navigate these choices, I'm reminded that their decisions don't just shape balance sheets, they shape the character of their institutions. They shape the confidence of workers who show up every day believing that their efforts matter, that their well-being matters. And in that belief is the foundation for unity, for resilience, for a society strong enough to endure the challenges ahead. The task, then, is steady and simple, though never easy. Lead with empathy, innovate with integrity. Remember that healthcare is not just a cost, it's a covenant. And in honoring that covenant, we honor our shared humanity. But the questions remain questions each of us must wrestle with. What kind of responsibility do we owe to one another when the pressures mount? How do we balance innovation with ethics, efficiency with dignity? And in the end, what kind of society are we choosing to build with the decisions we make today?